SciDays is important because it really brings the best of research to bear on the daily realities of what MSF confronts in the field in a very practical way to achieve better outcomes for people's health.
Innovation really is a method, and we also think of it as a mindset. It really requires different people thinking in different ways together. Do you want your innovation approach to be about incremental improvements? Or do you want to explore new technologies or novel ways to do the work that you always do?
We should focus on rethinking our operations. How do our approaches need to evolve to deal with urban migration, mega slums, people in flight? The stories will emerge. They are emerging already.
This process helps us to answer the vital questions that we are posing ourselves, the questions that will inform our future and our work with crisis-affected people for the next 20 years.
Hello, good evening, good afternoon, and good morning, wherever you are. And welcome to everybody who's attending our fifth session today for the MSF Dialogue Days. So we welcome you all. Today, in our session, we're going to be discussing the MSF Scientific Days, its history, objective, and the future. And we would like to welcome two of our speakers who are participating today with us in this session. First, I would like to welcome Dr. Bhargavi Rao. She's the lead for the Emerging and Infectious Diseases team at MSF Operational Center Amsterdam. She currently divides her time between working as a clinical focal point for the COVID-19 response and as the malaria and infectious disease specialist advisor. Bhargavi joined MSF in 2013 and is now based at the Manson unit in London, but has worked in humanitarian infectious diseases programming and outbreaks across contexts including South Sudan, Democratic Republic of Congo, Central African Republic, Chad, Ethiopia, India, Peru, South Sudan, and Venezuela. She's a clinician with a PhD in infectious disease epidemiology. Welcome, Dr. Rao. And we do have as well with us our second speaker, Dr. Bishmiraj Srivastava. He's a physician by qualification, started off his public health career at MSF OCA Operational as well Amsterdam Operational Center. Subsequently, he pursued his post-graduation at Johns Hopkins University, through which he had the opportunity to work as a consultant in countries like Sierra Leone, Uganda, Philippines, among others, as well as collaborating with organizations and governments like the Indian Ministry of Health and Family Welfare, the National Institute of Health, and the Syrian American Society. He has been involved in healthcare program management and designing innovative health delivery solution in resource-limited settings for better access compared to conventional healthcare modules. Currently, he is serving as the editorial lead for the MSF Asia Scientific Days. Welcome to our two speakers, and welcome Dr. Raj and Dr. Rao. We would like to start, as you know, in MSF, people do know about us or do know about MSF, that we're a humanitarian organization providing healthcare in different countries and different contexts. But when you do come across and mention the scientific days or what's the research that MSF do, it comes across as a surprise. Why MSF is doing scientific days and why we are involved in researches. So we would like to hear from you, Dr. Rao, if you can give us an explanation, a brief explanation about the MSF Scientific Days, its history, and how did we start? Thank you.
Thanks so much, Diala, and thanks to everyone online who's tuning in. I'm so pleased that we are extending our reach across audiences in different parts of the world. It's brilliant that MSF Dubai has been hosting this. So the MSF Scientific Days actually started in 2004. So this is our 17th year this year. And the aim was really to bring together researchers, field practitioners, academics, and patient representatives, in a sense to share experience, but also to really catalyze improvements in the quality of care for patients and communities in contexts where they are at risk. And the key here is why is MSF involved in this sort of research? And the point is that there is a huge gap that's well acknowledged between the evidence that is produced even in low and middle income countries and its application in humanitarian settings, the particular needs of humanitarian settings, our field missions, our field projects, and how do we apply evidence to those settings, but also how can we generate evidence on best practices? And the aim of these scientific days was to really sort of create a culture of best practice, to look at constantly improving the standard of care which MSF is able to deliver in our projects. And I think within that, there's a couple of other things. So there's certainly the generation of high quality evidence. I think uniquely amongst many scientific conferences, most of our research is very cross-disciplinary, and that reflects how we have to deliver care in our projects, of course. I think that we saw this as a huge networking opportunity for people from field, from headquarters, from different humanitarian NGOs, all of whom come and present at the conference as well. And I think also something that we've really taken on board in the past few years is the relevance of this in capacity building as well. So often the events, particularly when they were held in person, but even now when we're holding them online, that it's an opportunity for us to look at how do we extend the capacity to do research, to question, to think, to be trained in these sorts of techniques to various members of staff that perhaps aren't sitting in headquarters, but make sure that this sort of trickles down to our field missions. And the advantage of that, of course, is that the research is then really field driven. It's field focused, and it's deliberately targeting the needs that we see in our missions. Across history, what we've also done for the past 6 years is that we've then developed an innovation day. And that's the sort of people talk to us about what innovation means sort of in MSF. And I think for me, I would think about, we are constantly looking for better ways to deliver this high quality evidence-based treatment in incredibly challenging low resource settings. Unconventional settings need unconventional approaches. And that's whether developing new technologies, whether it's adapting existing technologies, or just finding better ways of working. So we recognize that there was a real importance to include innovation in the scientific days. And since 2015, they've been showcased through a separate day. We've developed a particular framework around humanitarian ethics and really looked at sort of bringing innovation work up to the same standard as our research. And then something I'm guessing you'll ask Raj about also is since 2015, we've also looked at ways in which we can develop regional communities of practice. So we now have a dedicated regional day for Asia, for Sub-Saharan Africa, and for Latin America.
Yes, thank you. We're going to go more into details with the research and the innovation, because this is a part of really, really important for as well. I would imagine for our audience to hear more of it. So as you mentioned that yes, the scientific days did start in 2004 as the first days of those scientific days. But what was the main thing in terms of how do we see that this is contributing to our social mission in the projects that we serve in the countries and to the population that we do serve as well?
Yeah, so I think that they contribute in a variety of ways. As I've already mentioned, we have some internal sort of benefits from capacity building amongst our staff about ensuring that research genuinely meets the needs and the challenges that we face in our field missions, right? I can give you a really good example, for instance, which is we have incredibly short stocks of oral cholera vaccine. Research that MSF did, firstly in Juba and then in Zimbabwe, looked at actually the efficacy of just using a single dose in outbreaks. And we found that there was an efficacy of over 87%. That means that, quite honestly, we're able to double the amount of cholera outbreaks that we're able to bring under control. We're really proud quite recently of a study that was just reported on World TB Day a few days ago, and that is TB Practical, which is a large randomized controlled trial of a new treatment regime for multi-drug resistant TB. And incredibly, they found that this regime of moxifloxacin and probenecid, let me just make sure I don't mispronounce any of the names. So of bedaquiline, protonamide, linezolid, and moxifloxacin, basically it can provide a 3 times benefit over the established standard of care with an entirely oral regime for just 6 months. I mean, that's a game changer for the world of MDR-TB. And if you think about our social mission of MSF, of, saving lives, preserving dignity and reducing suffering, it's very clear that our research that we're doing very directly addresses that sort of social mission.
Yeah, it's amazing to hear all of these achievements that we managed to do, especially with specific diseases like the TB and cholera as well, and the improvement. But do you think as well part of our scientific days is working on changing and doing more advocacy and changing policies, and who do we usually or in general when we do these kind of research, who do we collaborate with? Do we go with the Ministry of Health, for an example, staff in the field, other NGOs, the community there? How does it work in specific when we start with this research?
Yeah, it's a great question, actually. So I think that if I can give an example of really good advocacy that we've managed to achieve through some of our research, I'm reminded of work that we did in terms of community mortality surveys with the Rohingya, actually at the start of the crisis, when there was a great surge of migration and displacement. And the mortality surveys that we did featured on the headlines of most newspapers around the world, really highlighting the impact on this incredibly vulnerable population. Directly after that, for instance, there was a diphtheria outbreak, and MSF was able to collaborate with the London School of Tropical Medicine and Hygiene in order to use real-time modelling techniques to help us better assess what our operational needs were. How many beds did we need? How many hospitals did we need to build? And how much drugs did we need to order? And that was incredibly important, given that this was the first real diphtheria outbreak anyone had seen for the past 30 years. And we had very little knowledge or capacity on how to manage. And so I hope these are examples of both how we've used our research to progress advocacy, but also real impacts on our operational needs. Now, the way in which we sort of develop research within MSF is a really rigorous approach. I mean, so certainly, there is the ideas are developed, those are then passed to an ethical review board, but very critical in that is also is a real justification as to why this should be done in terms of benefits to the community served. So the idea is that we do not use our communities as a data gathering exercise. Every single piece of research that we do has to have clear benefits to the populations which we serve, both today and in the future. And also we have to minimize the risks. And that's a very critical part of the ethical review process. But in addition, we have to really be very clear about the dissemination process. So how do we collaborate locally, be it with ministries of health or local institutions? And that's become increasingly important when we talk about decolonizing global health. So how are we building capacity within our field with staff recruited from that country, but also local academic institutions? But also, how do we disseminate this? How do we engage with those communities? How do we explain to them what the research we do is about? And how do we also provide them with the results of that research? And those sorts of processes obviously vary depending on which group we're working with. And sometimes it may be through speaker events, it may be direct presentations to Ministry of Health, certainly inclusion of people like that within any sorts of publications we do, but also ensuring that things like MSF Scientific Days have a real reach with our field missions. It's kind of brilliant sometimes when you're in the field and you will see that there are dedicated video screens set up so that all of our field teams can participate in the day, they can interact. And I think that's certainly got easier. It's one of the benefits of the sort of secondary benefits of COVID, in a sense, is a real push to put things online, but also to encourage participation. And last year was our first year doing it. And I don't know if we'll go back to in-person conferences, to be honest, because the reach and the ability to participate has been transformative.
Yeah, that's true. Like the COVID year has changed quite a lot in terms of like how we communicate and how like we do events. So like that might be like a good segue as well, like to talk and ask like Dr. Raj about like their experiences as well, and like to have more of a broader vision of like the changes that happened in the MSF Scientific Days, and how did they start like with the Asia Scientific Days. So Dr. Raj, if you can like give us like a little bit of a brief as well explanation. How did we start, why it moved, and why did we decide like to focus on Asia as a region?
Great. So thank you once again for giving me the opportunity to talk over here about the Asia Scientific Days. Let me just share my screen to start the presentation, if that's okay with you guys.
Sure.
Can you guys see my screen?
I can see it. Hopefully everybody can do that as well.
Okay, great. So yeah, I've prepared a small presentation to take the audience through our Asia Scientific Days journey, some of the key milestones that we've achieved, and our future plans with relevant strategic goals. To start with, our vision for organizing this event is catalyzing evidence-based research to improve quality of care that is provided to patients and relevant target beneficiary segments, which could be populations residing in vulnerable healthcare systems or resource-limited settings, among others. The idea is that we achieve this through research and innovation promotion, while also supporting cross-pollination of ideas from relevant internal and external stakeholders on a common platform. Briefly, some of the key objectives from MSF's perspective for strengthening our association with the medical community includes creating greater visibility around MSF's identity in the region. Another key objective is to design a patient-centric strategy when developing themes for the relevant sessions. In addition, we use this event as an opportunity to reach out to the medical communities across Asia and highlight some of the major public health concerns from the regions that may also have a resonance with the global community for audience for these events. Our evidence generation strategy, like Dr. Bhargavi mentioned, is based on a field-first approach by investing in research that has relevant real-world application as a cornerstone, with the aim of enhancing knowledge and creating shared value, rather than investing in more of a blue sky research methodology. We also want to capitalize on this event by introducing external perspectives, opinions, by inviting academic institutions, medical colleges, other international NGOs working at the grassroots level, government bodies, and associated community stakeholders that can enhance our knowledge and shape internal MSF operations or activities, thereby improving the quality of care and services that we provide. Just quickly, some of the key principles that we keep in mind when reviewing our submissions include ethical and scientific rigor of the research proposals, diversity in the voices of speakers, researchers, and attendees to introduce interesting discussions and newer dimensions in our conversations, and taking a decentralized approach for abstract selections by giving a preference to those studies that have greater potential to impact ground-level operations, as well as practical operations for the field-level workers. This slide gives a broad overview of the timelines related to MSF Asia Sci Days and the changes or adaptations that we introduced over time to make our event more relevant for the target audience groups. As you can see, there has been a systematic increase in the number of attendees, along with participation from relevant countries. We have also noted a consistent rise in the non-MSF audience that has been attending our event, which is pretty much in line with our strategic plan to diversify our sessions by including more external academic partners. We've also been working on trying to identify how to make our sessions more interactive or engaging when we include the relevant audience segments. So in 2020, we organized our first fully virtual event with representation from around 10 to 12 countries who are participating either in presentations or panels or one-on-one interviews. And we had an audience of approximately 86 countries joining online. This slide gives a brief overview of our organizational structure and the associated committees that are involved in the program coordination and theme development. Accordingly, the core management committee comprises of the presiding officer, the editorial chair or lead, the executive manager, and the program lead. This team works in close coordination with all the other relevant stakeholders, whether it be the editorial committee, the comms team, or the communication team, and external partners or academic institutions. The editorial committee is the academic wing, which is basically involved in designing or identifying the key themes for the Side-Days event, planning the relevant sessions, reviewing or grading the abstracts that have been submitted, and supporting in any other academic exercises as required. We have designed the editorial committee to have a good mixture of MSF and non-MSF professionals, which includes physicians, public health researchers, microbiologists, epidemiologists, innovators, among others. Currently, we have a team of 11 members from across Asia, Africa, and Europe who are either connected with the different MSF units or external members who are part of reputed research and academic institutions such as the Imperial College in UK and the International Center for Diarrheal Disease and Research in Bangladesh. With respect to themes, we are constantly exploring newer areas or topics that should be highlighted in our events to reflect the emerging challenges in the Asian public health ecosystem. Accordingly, we've tried to maintain a balance between our core operational areas such as infectious diseases and humanitarian conflict, while also highlighting other issues such as increasing role of innovation in existing healthcare settings, especially when they have the potential to leapfrog the conventional healthcare delivery models. Other areas that we have generated during our conversations include decolonization of global health research and creating a roadmap to developing a sustainable shared value amongst all the relevant stakeholders. We've also been exploring how to make our conversations more interactive and interesting for the audiences by introducing newer communication styles such as panel discussions, one-on-one interviews, posters, among others, in addition to the regular didactic PowerPoint presentation styles. We've also live streamed our face-to-face sessions on Facebook for greater visibility and access to the audience who are not able to join us in person. As mentioned earlier, we organized our first fully virtual event last year, keeping in mind the COVID-19 pandemic. We used this as an opportunity to also align with our own experiences when handling critical patients from MDR and XDR TB across Asia, and how MSF was able to provide access to care even during this lockdown situation. In addition, we also explored the impact that this pandemic created in vulnerable population segments, such as Rohingya refugees or the Syrian refugees population groups. We also tried to identify certain neglected or emerging public health challenges, such as the rising burden of mental health issues amongst healthcare workers who are working at the field level, especially during the COVID-19 crisis, because a lot of issues, right from abnormal patient load to the stigma, as well as the fear associated with contracting this infection, makes them extremely vulnerable to either occupational burnout, anxiety, or depression. So we kind of wanted to highlight those areas as well. This slide highlights our expanding geographic footprint across Asia over the years. I think the focus of operational research during the initial years was primarily in Southeast Asia, but over time, we have broadened our scope of research to include other countries such as Syria, Jordan, Lebanon, Philippines, Vietnam, Cambodia, among others. Over the years, we have also had the opportunity to consolidate our position in the region where we operate by strengthening our network. This was done through engagement with institutions like Drugs for Neglected Disease Initiative, Health Advancement in Vietnam, which is basically a collaboration between Harvard Medical School and the Ministry of Health in Vietnam, Indian Council of Medical Research, TB Union, Syrian American Medical Society, among others. From the academic perspective, we also had the opportunity of engaging with universities such as University of Dhaka, Tata Institute of Social Sciences, and Mahidol University. Last year, we were actually planning to organize our Side-Days event in partnership with Mahidol University in Bangkok. Unfortunately, that was when the COVID-19 situation came up, so we were unable to organize a face-to-face event, and we therefore had to shift to the virtual platform. This slide gives, again, a brief description of the key audience segments that have been attending our event over the years. As you can see in the graph, the number of members registering for the event has been growing exponentially. In addition, the average watch time for the virtual sessions have also been rising. We've also noted, as mentioned earlier, a significant rise in the number of non-MSF members registering and joining the sessions. These include around 200 plus academic institutions, public health universities, government bodies, medical and nursing colleges across the globe. Some of the countries that did register were were audience members from UK, US, Philippines, Pakistan, Bangladesh, Nepal, among others. Thereby giving us a strong opportunity to have networking with the relevant organizations and consolidate the MSF operations in those regions. Audience from the different nationalities also went up to more than 85 for our virtual session last year, as discussed. With respect to the advertising and branding, our communications teams used a combination of social media, which involved Instagram, Facebook Live, Twitter, and LinkedIn, along with conventional media campaigns through newsletters, emailers, and personal outreaches, among others. Okay, so this is the last slide. I would like to conclude my presentation by sharing our plans moving forward. We will continue to expand our outreach across Asia through engagement with key stakeholders, influencers, policy and decision makers, and the associated academic institutions. Our short-term objective is therefore to develop Asia SciDays as a collaborative, multi-section initiative designed to strengthen or support MSF's operations in the respective regions. In the long run, we hope to build MSF Asia SciDays as a medical operational hub for research and innovation across Asia and beyond. I think that's about it from my side. Thank you so much once again for your time, for inviting us for this medical dialogue. Over to you.
Yes, thank you so much, Dr. Raj, for this comprehensive presentation. To follow up on it, I would like to ask how do you divide between the topics and the researches that you want to do between the regions? So for an example, you do have the scientific days that are happening in the UK, and then the ones in Asia, and as well there's so I'm just wondering how you find the topics, how do you find the topics, and how do you do the division between the different regions? Is it based on medical topics, based on locations? For an example, if Asia is working on on more of the Asia context, the UK depending on the area. So if you can elaborate on that a little bit, please. Dr. Raj, we can start with you, and then we'll move to Dr. Rao. Thank you.
Okay, sure. So I think it's a multi-institutional level coordination. I think the UK SciDays or the international SciDays kind of has representation from the Asia SciDays as well, and vice versa. So discussions regarding themes, discussions regarding topics that we need to highlight, although there might be a broad understanding of the key areas, I think it also depends on the type of submissions that we get. And based on those submissions, we kind of design how do we want to develop the relevant themes. So it kind of goes in tandem between the relevant SciDays. So I think the international SciDays kind of sets I wouldn't say this sets a benchmark, but it kind of sets the template on the basis of which the other relevant regional SciDays also plan their events.
Thank you, Dr. Raj. And maybe to follow on that, Dr. Rao, if you can just give us a little bit of an explanation of how can people actually submit to the scientific day, those abstracts, and how do people, what are the topics, what is needed for information that they need to provide?
Yeah, of course. So as Raj mentioned, I mean, there is what you're calling the UK days. We tend to call the international day because that basically is for across the movement and for across all regions. In the past, it happened physically in the UK, but that's sort of the only real affiliation in a sense. It is very much for across the movement. And then obviously we have these various regional days, Sub-Saharan Africa, Latin America, and Asia, and they're very much about targeting the diversity of audience that may be important locally or more regionally. So creating a community of practice, perhaps focusing on issues and themes that may be more important within that region that perhaps aren't able to be highlighted or showcased in the International Day, which is across the entire organization. As Raj said, our agenda is in the main very abstract driven. So there isn't there is an abstract submission process by which people send in the results of the work that they have. If you do that from within MSF, you usually have to get sign off from your either your kind of your managerial line within the operational center that you belong to. And including in that an ethics submission status. So be warned, if you haven't got some sort of ethical approval or some ethical sign off, then we won't consider. The abstracts are then looked at by, for the MSF International Days, they're looked at by a really large editorial committee, which includes sort of senior researchers from within MSF, external academics, but also really critically representatives from the major medical journals. So the Lancet, PLOS Medicine, BMC, kind of the top quality medical journals all send their editors to our editorial committee. And that's a really great process for both increasing the visibility of some of our research, but also ensuring that what we showcase is at that level. It is properly and rigorously reviewed. Part of the process, once we've selected those abstracts, is also then to really help the presenters finesse their work and give them presentation training, etc., so that when it comes to the day, we've really sort of equipped people with the skills that they need in order to present to this conference, which frankly, people tune into from 108 different countries and over 2,500 people. So it's a significant conference on the humanitarian medicine side. In terms of the submissions to the regional events, they of course are able to pick from abstracts that were submitted to the International Days. Plus, there are some abstracts to a secondary sort of process, a slightly delayed process, where people can submit to those days kind of directly. And that may be because it's a regional academic institution, it may just be timing a little bit delayed. So the idea is that all of the agendas are complementary, that the agendas address regional needs if need be, but also the big kind of issues that we face across MSF. So for instance, one of the big issues for this year is certainly around community engagement and asking the community, what needs are, what impacts are. And that in a sense is driven by some of the decolonization agendas, requiring kind of us to be more in tune with the needs of our beneficiaries. But also this recognition that our research needs to be co-designed by communities, it needs to be driven by communities. And this has been a hope, I think, for MSF for many years, but I think we need to look increasingly at how well we're doing it, how we can learn from other agencies, other academic partners. So that's a big theme for this year. And how do we really embed patient-centered care? Also issues around sustainability, climate change, but also where can we as MSF be pushing the boundaries? So what's MSF's role still now in terms of HIV, TB care or malaria in humanitarian settings? So a lot of the malaria dialogue globally at most international conferences is around elimination, right? But actually what we are showcasing this year is very much about how do we address it in a conflict setting? How do you do a mass drug administration in a conflict setting and get high levels of coverage and reduce levels of malaria? How do we look at vector resistance? How do we look at the differing needs of malnourished children in African settings or Asian settings? How do we look, and another real advantage is how do we compare settings? So for instance, last year we looked at hypertension management in refugee settings, comparing Jordan with Zimbabwe. And how do we use fixed dose combination tablets across those two settings? How do we improve diabetes management? So we had a really great presentation about continuous glucose monitoring in Jordan. And then we can compare that to work that we've done in sub-Saharan Africa. So some of the joy of these days is also comparing the different contexts and really seeing how we can learn from our different missions.
Yeah, it's very impressive, like kind of work, and I'm sure that it takes like as well like a lot of time and like years in terms of like proving like those like researches and working on them. So like I'm wondering actually, like after like that you do like these research and come out like with conclusions and recommendations, how do you implement that like in the field and in certain like projects that like we do have or that we work in? So yeah, Dr. Raj, please.
So I guess I can give an example of one of the exercises that we did in Bangladesh, primarily regarding one of the lower income settings or the slum areas in Dhaka, where we were very concerned mainly with the occupational safety of certain factory workers who were living in very difficult settings, I should say, and who were highly vulnerable to occupational health hazards. So I think a couple of years back, we did have a research primarily evaluating or doing a baseline assessment of the situation over there, the incidence of those kind of occupational health hazards, and what kind of interventions need to be taken to tackle or combat that situation. And last year, actually, we kind of had another submission, or this year, sorry, we had another submission that kind of discussed about once that intervention plan has been designed, what kind of impact is it going to have, and what kind of role will it play in changing the policy structures. So it wasn't just something that was done as an independent MSF event, I think, or as an independent MSF exercise. It kind of went as a partnership between the government stakeholders as well as the external academic partnerships. So it wasn't just one-off random abstract. I think it ended up becoming like a journey, where it started off as a baseline exercise, but it ended up bringing an actual impact or change in the lives of those health workers. So I think that is something that we kind of aim to develop through our activities or exercise. Yeah.
And if I understood that correctly, like that after like we get like the research done and finalized, like before as well, like implementing it, like of course we do share it like with the Ministry of Health and the community health workers like around this area, like for us to be able like to implement it. Is that the process afterwards?
Yes, of course. I mean, we have to follow the regulations and compliances in those regions. So it's always done as a holistic exercise between the relevant stakeholders as well. Yeah.
Okay, good information and good to know that. I'm going to move like a little bit to the innovation part, because like as you mentioned, Dr. Rao, like the innovation like part, like we started like with it like recently, like I would say not recently that much, but like in 2014, 2015. So it's as well like a really big effort like of work that like we're doing in that aspect. So like when we say innovation, what do we mean by innovation? What like are the topics that like we're looking into, and like how what's mainly like how it's like showcased, and like how do we work on that? And is it as well like part that like of our like field workers or researchers like would propose as well abstracts like the same as like during the scientific days and the researchers?
Yeah, it's a great question, Diala. And I think any of us who've worked for MSF will kind of know that, I mean, innovation is putting a big word on it. I think at the end of the day, this is workarounds to help us deliver care better. And it's very much about being field driven, right? Because it has to answer the challenges that we see in the reality of our work. And I think often we use the word innovation and people think it's all tech, and it really isn't. You know, the sort of stuff that we've showcased through MSF, through the scientific days, has been everything from how do you hang an IV bag inside a Land Cruiser, right? So anyone who's worked for MSF will know those Land Cruisers that we use, and they are, you know, there's sort of benches at the side, and that's what we transport patients in. How do we safely hang an IV bag in that when you're going through some very rough terrain? Something that we've really sort of started to implement already in the field are things like point of care ultrasound. Ultrasound is not a new thing, right? But how do we then train our field nurses, people in quite remote settings to use point of care ultrasound rather than having to go to a specific ultrasound lab in a hospital? How do we do that at a community level so that we can diagnose everything from sort of pneumonias to sort of pregnancies better? But I think perhaps my favorite example is really this recognition, and this is a little bit tech, I suppose, which is that for many of the areas in which we work, there are no maps. There's no good maps. And so something that very much arose out of MSF in partnership with some other agencies is this idea of missing maps. And they used sort of humanitarian open sort of street mapping and community mapathons in order to put together base maps of many of the regions in which we work. And that is now so successful that it's used as a baseline for many of our interventions, right? So we use that to understand geographic reach, population counting. We've used it everywhere from SGBV, sex and gender-based violence campaigns in Haiti, to planning kind of mass drug administration in Central African Republic this summer, when we had to do that in the face of COVID to prevent malaria. So the applications of some of these innovations, be they as simple as an IV bag to kind of, digital mapping, are immense, but they're very much designed to sort of address real field challenges.
No, that's like really impressive. I'm just like wondering if there were like any of these like innovations that were done, for an example, like in the Middle East, and they are like used, for an example, like in the Middle East like region, that like we're doing at the moment. If Dr. Raj, like you do have any further information about that.
Well, we are getting a lot of submissions for this year specifically regarding innovation in the Middle East. One of the areas that we kind of wanted to focus on was the Syrian refugee crisis. So some of the Syrian settlements in the areas neighboring Jordan have been having a lot of challenges regarding mass vaccination campaigns for children. So there was this new intervention that was developed as a smartphone-based tracking for improving the coverage, as well as for better communication and treatment vaccination adherence amongst the parents as well as the target segments. So that was a very interesting, it wasn't an MSF strategy, I think it was an external submission, but it was very, very interesting in the sense that how a smartphone device can help in changing the mindset, the communication, as well as the treatment adherence. So that is definitely something that we are hoping to showcase in our event this year. Yeah.
Yeah, thank you. And a good point that like you raised there, because like maybe like in our talk, it wasn't like very clear that the submissions as well could be like external and internal. So like if we do have like external researchers that they would like to submit for the scientific days or the innovation, like how can they do that depending on the region? Or does that go like through as well, like the international scientific days?
So it's a combination. If they want to have a submission for the regional events also, they can just, we can just share the link over here also. It's on the MSF Asia or MSF India website. The call for abstract is open. So that is always an option for submissions. Yeah.
Yeah, excellent. We do have as well like a question from the audience who's asking us like any of the research has been done with local community health workers already in like a specific like settings, and do you use their inputs and wisdom during like our work and operations? So Dr. Rao, if you can elaborate on this, please.
Yeah, absolutely. I mean, I think that one of the key principles of us doing any sorts of research is working with the communities in which we are housed, and so certainly there is engagement in the community and what they think of the proposals, if there are any inputs to improving these proposals. One of the things we're going to showcase this year is around community assessments for COVID, and really looking at the way community perceptions were. For instance, at the beginning of the pandemic, there was a lot of talk about shielding of vulnerable communities. And of course, some of that relies on what are community understandings of COVID and how they might react to different, how they might perceive different interventions. So we did a wide scale engagement study across multiple different countries around what communities' perceptions of COVID were, how they felt this would impact them and their families, and what sorts of interventions would they be happy to undertake, accept, and how might they adjust those for their own particular needs. And it's been incredibly insightful as to how we can to sort of deploy some of those. So in Jordan, for instance, in one of the refugee camps in which MSF works, it was recognized that there was a real community backing for some shielding interventions, and that was actually deployed and is still being deployed in order to protect certain very vulnerable areas of the community. In other areas, that wasn't seen as something that was important or acceptable. And so we've had to work with those communities to look at different ways in which we can provide care. In Syria, we've used these things in order to look at how do we track patients at home with COVID so that we can ensure that when they do get sick, they're able to come back to our facilities. So it's very much about tailoring the research we do for the communities that we work with.
Yeah, thank you so much, Dr. Rao. And maybe, because I guess we're in the last few minutes of our discussion, and since we're doing this event is arranged by Dubai as well, and most of the audience are from the Middle East. So maybe if Dr. Raj, you can elaborate on MSF Scientific Days vision in the Middle East.
Right, sure. So I think we've been engaging with the Middle East or specific countries in the region for quite some time since the past few years regarding research as well as newer areas that we can explore. Some of the areas that for this year, I think we were very interested in identifying was regarding the increasing vulnerability of antimicrobial resistance that we're observing as a rising pattern or challenge, especially in the protracted conflict settings. So that is something that we are very interested in either showcasing as a panel discussion or highlighting in our discussions during the event. Other areas such as the role of innovation in improving the quality of care, or as Dr. Bhargavi mentioned, might not necessarily be technology, but any kind of health delivery model that leapfrogs the conventional system and improves quality, access, and care can be very important interventions that we are planning to highlight in our events. So the idea is that it's not just a collaboration, but also an opportunity for strengthening our association in the region, as well as supporting the cause of MSF operations in those areas. Yeah.
Thank you so much, Dr. Raj. And maybe as well, Dr. Rao, if you can just give us as in May, it's going to be the international as well scientific days, and it's going to be online. So if you can just wrap up what are the topics that's going to be discussed there, and what are the abstracts maybe that were submitted for those days.
Yeah, so I think this year we've had to take into account the challenges of COVID in a sense. So rather than having one day, they're spread, the sessions are spread across 3 days, and there's some really exciting things, I think, certainly with a real focus on the humanitarian and conflict setting. So one session will be about the frontiers of HIV/TB work in humanitarian settings, particularly things looking at TB in adolescents, new ways of diagnosing HIV at an acute stage, and also looking at the interaction of diseases such as leishmaniasis with HIV. It's something that's really critical, particularly to our Middle Eastern and Asian settings. We've got a whole session on malaria in conflict settings, in complex humanitarian emergencies, which will be stands for itself. And then again, another session on innovation in malnutrition. And again, looking at the differences between Asia and Africa and how we need to adapt our care. The showcase session, the keynote is going to be by Dr. Rani and Abhay Bang, who are absolute world leaders in the idea of community-driven research. They're from a small village called Gadrucholi in India, where they've been for 25 years. And they've really put together over 25 years a community-driven research agenda. So the purpose of that day's sessions will be very much to look at how we can emulate some of that in MSF. How are we able to ask communities in different ways about what their needs are, be it through community surveys, sex and gender-based violence, or through asking men rather than only through asking women for their about the services required and the assistance needed within communities. And then we've got a sequence of work on COVID, community assessments, but also using that data to then back model what may have happened in certain regions with COVID to give us better answers, a different way of assessing what has happened in these regions, rather than just relying on blood tests in the way that people previously have. Through the Innovation Day, there's sessions on digital health promotion. So how do we improve accessing health information in communities, but using digital means, sustainability. And then again, also some issues around community engagement, but using digital technologies. So very exciting. I hope you guys can tune in.
Yes, it seems to be very exciting. So hopefully people maybe we'll put the link as well for the events, and people could join and participate in it. This session definitely needs more time than 45 minutes, because the discussion is very rich, and there's like a lot of information that as well like could be highlighted and raised in these sessions, but hopefully we will be able to do such a discussion sometime soon. Thank you so much for you, Dr. Rao, and for you, Dr. Raj, and thank you for our listeners and participants like in the session. Thank you, and have a good day. Bye-bye.
Thank you.
Thank you so much.
Thank you so much. Bye-bye.
Thank you, everyone. I will speak now in Arabic. السادات والسادة الحضور، شكرا جزيلا على استماعكم. دلوقتي معادنا مع جلسة ستبدأ الآن على Channel 1 عن نزع السمة الاستعمارية عن المساعدات الإنسانية مع دكتور تمام العويدات، ويحاوره الأستاذة بوسينة أسامة، المنسق الإقليمي لشبكة سايدف، شبكة العلوم والتنمية في الشرق الأوسط. شكرا جزيلا مرة أخرى.
شكرا.